Good morning and welcome to the Homes Committee of Management. The date is November the 12th, 2024. It is approximately 11:46 a.m. and I will call this meeting to order. First order of business is the approval of the agenda.
Resolved that the November 12th, 2024 Homes Committee of Management agenda be approved as presented.
Do we have a mover and seconder for this? Committee member Cookett and committee member Latham. All in favor? That's carried. Adoption of the minutes.
Resolved that the minutes of the meeting held on August 13th, 2024 be adopted.
The minutes have been circulated. Are there any errors or omissions? And if not, entertain a mover and seconder. Committee member Jones and committee member Widner. Second, all in favor? That is carried. I will remind the committee of disclosures of pecuniary interest and the general nature thereof. I will note that there are no delegations scheduled for today, which brings us to reports and briefings. So section 6.1. Homes, the Committee of Management, Long-Term Care Directors update July the 1st, 2024 to September 30th, 2024. Good morning, Michelle.
Good morning, Mr. Chair, through you to members of the committee. Included in your agenda package today are two reports. The director's report, which highlights the communications received from the Ministry of Long-Term Care and Ontario Health West and the impact to the homes. And the second report is the operational report, which highlights some pertinent departmental and committee updates, as well as inspection outcomes. For this morning's meeting, I've prepared a PowerPoint presentation to walk you through the highlights of both of those reports. Next slide. And those are just the agenda items that we'll cover off. So we'll go to the next slide. Okay, so on July 31st, 2024, the ministry released a memo regarding what's called inter-RI long-term care facilities assessment. It's a new mandatory standard for our quarterly resident assessments. You've probably heard me talk here before about MDS-RI and CMI. So this new assessment tool is going to replace those prior assessments, and the ministry did inquire and ask for some early adopter homes to participate, and 50 homes were selected for that first round of early adoption, and there'll be other opportunities for homes to participate. So the Algon County Homes will apply and hope to be considered for future opportunities. However, by April 1, 2026, all of the homes across the province will be required to participate in and to utilize the new assessment tool. Next slide. So why is this change important and why am I highlighting it today? So every resident assessment that we do contributes to our long-term care home level of care funding, and that's that CMI funding that I talk about. Every assessment also contributes to our outcomes of our Ministry of Long-Term Care inspections. And so we have what's called our case mix index. And I've shared before at this table through budget meetings that our three homes do very well. We're scoring in the top 10 to 20% across our three homes. And we do want to maintain that because our level of care funding certainly supports the long-term care home operations. So how will our homes prepare for this change to the LTCF? We've already begun that work. So we've been reaching out and doing some engagement with our partners. Point Click Care is highly involved with the ministry working group to implement this change as they're creating the assessments, developing them. And we are involved in a new project called the RNAO Clinical Pathways, which has really allowed us through the launch event to learn more about the LTCF. So we're feeling like we're getting a good understanding of what that looks like. And then we'll be doing some training and education for our frontline staff that will be conducting the assessments, and for managers to ensure that we're prepared to support that implementation. And the training costs for that are going to be covered off through some one-time funding that we have received. So Point Click Care, you hear me talk about Point Click Care regularly. We need to make sure that we're working with them throughout this integration and change to ensure that the timely updates are being done on our end so that we have the assessments in place And they all link to that, again, to our funding and to our inspection outcomes. And so there'll be some policy and procedure work to be done as we work through that project. On the next slide. I wanted to share a little bit about the Comprehensive Minor Capital Fund. So on August 22nd, the ministry also released a memo regarding the funding for the timeframe of April 1, 24 and to March 31st for Comprehensive Minor Capital Fund. So all three of our homes are eligible for this funding, and they've titled it Infection Prevention and Control Minor Capital. And so there's three categories. The first is highly related to minor capital improvements that impact or improve our infection prevention and control practices. So over the time, we have implemented touchless faucets. We've done some work to our ventilation systems. We've implemented measures to support physical distancing, those types of items. The funding can also be used for just minor capital to maintain and extend the life of our long-term care homes. So replacements of roofs, sprinklers, electrical systems, nurse call systems. Those are some examples. And the third criteria or eligibility for this funding doesn't seem to necessarily fit, but we used to have a base funding in our nursing and personal care envelope, and it's now been moved into minor capital, and this is falls prevention equipment. And our base funding has been moved here. So this is items to support reducing falls and improving mobility. So items we would purchase here would be falls mats and high-low beds, grab bars, alarms on beds and chairs to alert staff if somebody's trying to get up without assistance. This funding does exclude routine maintenance. And the next slide. So as part of our 2024 budget planning, we anticipated we would get some funding, but we didn't know what that would look like. So we worked with the finance department when we were planning for the 2024 budget, and we budgeted based on the prior year's funding. You can see here on this table that we've got what we budgeted and what we actually received with the August 22nd announcement. So there is a shortcoming for each of the three homes there. However, the home's approach to the spending of the minor capital was very conservative while we awaited the announcement for the funding. So spending will not exceed the actual funding. Next slide. So I just mentioned something new to you, the RNA clinical pathways. You're very familiar with the fact that our homes are RNAO best practice spotlight organizations, and we were designated a couple of years ago, and we've been implementing best practice guidelines. So we've implemented falls and restraints and pressure ulcers and resident and family-centered care. The clinical pathways is an extension of the BPSO project work, and we are actually cohort 7. So almost 50% of the homes across the province are now involved in the clinical pathways project. It is standardized evidence-based clinical support tools. The difference here between our BPSO work and the clinical pathway work is that the clinical pathways have a strong connection with point-click care. So the work that we'll be doing for the clinical pathways is integrated with all the work that we're doing. When we had to do our BPGs, we had to try and create tools on our own, and they weren't connected through or integrated with other pieces of our documentation. So we're very, very excited about this opportunity and the opportunity to streamline and reduce duplication. And so this work is being funded through an integrated technology solution that will cover the costs for the software as well as the access to these tools. And then the one-time funding will support the training of our frontline staff who will be utilizing these tools. Another opportunity that we see is that the clinical pathway work aligns very closely with the mandatory programs within the Fixing Long-Term Care Home Act. And so it's anticipated to support positive future ministry inspection outcomes. The next slide. So again, it's standardized, it's evidence-based clinical support tools. And for our year 1 focus, we have 3 assessments that we're going to implement. The first one is called an admission assessment. It's not that we're not doing these already. It's just reformatting and updating them and making sure they're integrated. So the prior cohorts have shared with us that once they implemented the admission assessment, on average, they found 2 hours of saving of registered staff time when completing a new admission. And that's time that can then be spent with our residents providing care and services. The delirium assessment, this is not currently a mandatory assessment, but this, when staff identify some signs and symptoms that may potentially delirium related, they would do the assessment. Now we're required to do it. And so the earlier cohorts are sharing that they're finding the delirium opportunities more sooner in the provision of care. And resident and family-centered care assessment, again, it's information that we've been pulling from meeting and care conferences, but this is just more supportive information at the time of admission. So we will be going live in March of 2025. And then in year 2, we have 2 more assessments, and year 3, 2 more assessments to complete. The next slide. So currently, we've conducted all of our gap analysis for the 3 assessments that we need to implement, and we're working with our contact with RNAO. We have a designated support person to implement these assessments. We're clearly seeing the opportunity to streamline our processes and reduce duplication and standardize our assessments. And all of this work will support, again, our legislative requirements. We've had the opportunity to participate in knowledge exchange events where we've heard from the prior cohorts, some of the examples of how this work is supporting them. Our quality improvement lead is highly involved in the work. And our MDSRI coordinators who submit those assessments to support our funding, we've had them involved since the onset as well. They've created a sandbox for us with Endpoint Click Care so we can go in and test the assessments to make sure that everything's functioning as it should before we go live. And the next slide. So here's myself and our administrators and our directors our managers of resident care across our 3 homes attended a 2-day launch event to learn more about the opportunity and to begin preparations for that work. And the next slide. So in my report, you'll see the outbreak status information. So each of our 3 homes, so Beaubier Villa continues to have no outbreaks this quarter. And in fact, they've gone 1 year outbreak free. So they had a little celebration, and there's a photo there showing that day. Elgin Manor in this quarter had 2 outbreaks. They were both COVID-19. And Terrace Lodge had 1 outbreak, which was rhinovirus, which is your typical common cold. And so the next slide is going to speak to mandatory masking. So there were a lot of outbreaks happening in the summertime, a lot of activity. And then in September, we did see a spike looking at the local and regional data. In fact, across Elgin and Oxford, there were 13 healthcare facilities that had a COVID-19 outbreak in the month of September. And we saw with back to school, we saw more staff that were having absences related to respiratory symptoms. And so we had a lot of discussion on our end about mandatory masking and should we re-implement that. And so we did make that bold decision to re-implement in October for staff, students, and volunteers. But we're going to continue to monitor mandatory masking as we move through cold and flu season. We'll look at the data. Is there an opportunity to pull back, or do we need to maintain that? We were one of the first, we were an early adopter. And since that time, we're seeing other long-term care homes and hospitals also resume to mandatory masking. And it was highly supported by both our resident and family councils. On the next slide. So we're also gearing up for fall preparedness. We've had infection prevention control assessments completed by our IPAC managers, but also we invited our Southwestern Public Health teams to come into our homes and do some assessments, some very minor recommendations, which we've worked to implement. We are required to do every other week a full audit of our IPAC practices, and if we're in outbreak, once a week. And education is ramped up for staff, residents, and families and visitors for personal protective equipment, hand hygiene, and screening. And the next slide. So you can see here that Elgin Manor has developed a really big sign trying to draw attention to cold and flu season and just bringing some information to their awareness about some of the precautions and measures that they should be taking and implementing. Another big piece of our infection prevention and control work at this time of year is our vaccination updates. So you may be familiar in the media with RSV. So we did receive communication from the ministry that we needed to prioritize vaccination for our residents, worked with the medical directors to get a directive in place. And a very high percentage of our residents across the 3 homes are now vaccinated for RSV. COVID-19 vaccination was paused in September because they did do an update to the vaccine. So we now have the updated vaccine, and we've resumed vaccinations for COVID-19 as well as influenza. We've received our influenza vaccine at the homes now, and so that work is being prioritized across our 3 homes. You probably are aware, but I just wanted to point out that we did receive the information for the Ontario Dental Seniors Care Program. Oral health is such a key contributor to everyone's overall health, but especially the elderly. And so heart health is very closely linked to oral health. So that's an important piece to consider. And this Seniors Care Program does provide affordable access to dental care for residents of our homes. And we were very pleased to hear that our contracted dental care provider is registered with the program. So that does support that service within our homes. And the information has been communicated to all of our residents and families. A highlight of our inspections. So no Ministry of Long-Term Care inspections during this quarter. Terrace Lodge did have Southwestern Public Health in and completed a food safety inspection of the kitchens in July, and there were no concerns identified. We did receive a site visit at Elgin Manor from the Ministry of Labor, Immigration, Training and Skills in August. And that was to review the established COVID-19 IPAC measures. So the Ministry of Labor is aware when we have outbreaks in our homes, and so they will prioritize some inspections. There were no concerns identified during that visit, and no orders were issued. And the next slide. So Beaubier Villa also received a site visit from the Ministry of Labor in September, and it was related to workers caring for residents with responsive behaviors. There were 2 orders issued, and both of those were resolved. The first was related to the workplace violence risk assessment. It had been completed for 2024, but the expectation of the Ministry of Labor is that we should have done a review and update of that assessment when we had some increase in responsive behaviors. So that work has now been completed. And the second was in relation to protection of the worker while providing care for residents with responsive behaviors. And we identified a couple of additional interventions that could be implemented, and the education was provided. And the next slide. Just wanted to share some of the education that's happening across the homes. For our frontline staff, there's the Canadian Mental Health Association has developed a healthcare specific 15 minutes training sessions called Wellness Moments. And so we had them into our homes and they went unit to unit. We had staff to cover the staff that were participating in those 15-minute sessions. The feedback was that it was highly valuable. And so we are planning in 2025 some additional more focused training on stress in the workplace to support our frontline staff. And that those training costs will be covered through some one-time funding. Our diagnostic equipment training continues. You probably recall me talking about eConnect, which is allowing our registered staff to go on to Point Click Care and view reports and information from a resident who was in hospital visit. That was paused because we did have an interruption with Point Click Care on their end, so we hope to get that resumed shortly. Behavioral Supports Ontario training. We've had a couple of new staff in our homes that have onboarded, and so training's been happening there. And I've already spoken about the infection prevention and control training. I wanted to share some photos of some of the programs that are happening at our homes. And so certainly we have bus trips where residents are able to participate and go on an outing. So here's a number of our Beaubier Villa residents enjoying a nice lunch outing on a beautiful day. And pet therapy is very much enjoyed at our homes. And here's somebody enjoying some time with a furry friend. And the next photo. And here at Elgin Manor, the residents had the opportunity to husk their own corn in the summertime for their lunch, and quite enjoyed that experience. At Alga Manor, they also, each of our homes has theme days, but at Alga Manor, they had a Caribbean Day of music that was very much enjoyed. And following that, they were able to head on over to the Caribbean Day Tiki Bar to enjoy some refreshments. So that was a very much enjoyable event for the residents. They also had a country hoedown where the ice cream truck came to visit at Alga Manor, and that was a popular event. And the Summer Olympics were celebrated across all three of our homes, but we got some great photos at Terrace Lodge. So here's a couple of our residents participating in the arm wrestling competition. Terrace Lodge residents also submitted quite a number of entries into for the Elmer Fair. And so there were a number of ribbons from participant all the way up to first place. And they also did at Terrace Lodge a gorgeous grandma photo shoot day. So the female residents of Terrace Lodge had their hair done, and they had the opportunity to head out into one of our new outdoor spaces at Terrace Lodge and have a photo that would be treasured by their family afterwards. So a great number of participants. The gentleman also had a gorgeous grandpa photo shoot day, and they had a Model T Ford in Terrace Lodge so that they could have their picture taken with. And Terrace Lodge Resident Council membership, they decided to do a board at their home to just display and provide some information about each of their roles and the opportunity to participate actively in our resident council. Terrace Lodge also participated in the Art in the Park in Elmer, and you can see a few ribbons there. And that's the very high level of the great amount of information that's included in the reports included in your agenda, but I'm happy to take any questions you may have.
Thank you for that presentation, Michelle. Does anyone have any questions? Deputy Warden, excuse me, Committee Member Jones.
Thank you, Mr. Warden. Just a concern, I hope no residents had any thrown out shoulders after the arm wrestling, but
I was a little worried about that when I heard about it too, but they only had a great time. That was the only effect they had. Thank you.
Any other questions or comments? Councillor Hens, Committee Member Hens.
Thank you, Mr. Chairman. Michelle, it seems to me that the province is making more demands on reporting and looking after our residents. Does the funding come anywhere close to providing for the additional work that it is entailed?
For that great question. You may recall in our last meeting that we did receive highest since I've been manager. That was pretty groundbreaking. There was the one-time funding. The RNA pathways is a great opportunity. Our frontline staff and
Anyone else? Okay, thank you. Combined. I would assume we might as well, because this was a combined presentation. Okay.
Resolved that the report titled Homes Committee of Management Long-Term Care Directors Update, July 1st, 2024 to September 30th, 2024, dated November 12th, 2024, be received and filed, and that the report titled Homes Committee of Management Long-Term Care Operational Report, July 1st, 2024 to September 30th, 2024, dated November 12th, 2024, be received and filed.
Do we have a mover and seconder for that? Committee Member Henson, Committee Member Cookett. All in favor? That's carried. Thank you. We do have a closed meeting session?
We don't.
No, we don't. Brings us to the date of the next meeting. At the call of the chair. So we're at the adjournment.
Resolved that we do now adjourn at 12:11 PM to meet again at the call of the chair.
Do we have a mover? Committee member Whitner? Committee member Latham? All in favor? That's carried. Thank you.